Hi, my name is Mia D. Watterson, and today my project is going to be talking about the coronavirus disease, specifically COVID-19. So we're going to go about talking about what it really creates the disease itself. We're going to talk about the causative agent, pathogenesis, virulence factors, epidemiology, treatment, things like that. So specifically, COVID-19 is the disease SARS, COVID, or CoV-2, my bad. SARS stands for this is so annoying. Oh, like, why? Hi, my name is Mia D. Watterson, and today I'm going to be talking about the coronavirus disease, specifically COVID-19. Today we're going to go a little bit more in depth about what creates COVID-19 itself, the causative agent. We're going to talk about virulence factors, transmission, things like that. So first, what is coronavirus? COVID-19 is the coronavirus disease from 2019 specifically. It's caused by a virus called the SARS-CoV-2. SARS-CoV stands for severe acute respiratory syndrome coronavirus. That itself is really contagious, and it spreads very rapidly. Unfortunately, over 1 million people, and probably by now that number has drastically increased. People have succumbed to COVID-19 disease in the United States. Some people, though, it starts off as cold and flu-like symptoms, but you may be completely asymptomatic or unfortunately have to be hospitalized because of how severe your symptoms may be. After having those flu-like symptoms, people may develop post-COVID conditions called long COVID, but I'll get into that more in one moment. Signs and symptoms. So COVID-19, like I said, starts out maybe more of like a cold flu, but because it is a respiratory syndrome, it can attack your lungs, and it really may feel like you have a lot of chest pain, a lot of pressure, labored breathing, body aches. Those are signs that you may have COVID-19. Also, one of those most prevalent signs was the loss of taste or smell. People may just be out at lunch one day and just take a bite out of their sandwich and just can't taste it. And so that may be a really big indicator that you have COVID-19. An emergent sign, though, would be that you have blue lips and that you have severe chest pain, because when you have blue lips, that means that you are not getting enough air into your body. Symptoms would be sore throat, runny nose, nausea, and a persistent cough, fever, chills, things of that nature as well, like you would see in your average cold. And like I mentioned before, long COVID is when people still have those effects after, whereas a big example would be that loss of smell, loss of taste. It's not necessarily that people can't taste at all. It's more that things don't taste the same. Those taste receptors have just completely like shut off. So one day you love Dr. Pepper and it's the sweetest thing ever. It's your favorite drink. And then the next it tastes like gasoline to you. It's really unfortunate. I feel really bad for people who have dealt with that, because I don't know what I would do if I couldn't taste ice cream anymore. So Yeah, those symptoms can affect people from weeks to years and sometimes can even result in a disorder, disability. General symptoms are, again, that malaise that you get that really interferes with your daily life. You can have those respiratory symptoms, again, the shortness of breath that just prolongs for a while. You can have heart palpitations, neurological symptoms that you may have during long COVID or during COVID. You could have difficulty thinking. That's also known as brain fog. Excuse me, when you stand up, you can get really lightheaded or maybe even see those spots and have to sit right back down. Pins and needles and change in smell or taste. And unfortunately, you can succumb to depression or anxiety as well. Digestive symptoms may occur as well, where you get diarrhea and really bad stomach aches, muscle pains. And if you are on your menstrual cycle may change as well. So here we've got our causative agent. You can see, sorry, I'm trying to get my better. You can see right here, we've got SARS-CoV-2. That's our spike protein. We've got our envelope protein. We've got our membrane protein. And then here in the nucleic capsid protein, the N protein, we've got ribonucleic acid. That makes it look kind of like a candy cane, in my opinion. And then the N protein here. Those are all the genome structural proteins that make it that complete viral substance particle. Coronaviruses themselves, they are associated with the Coronaviridae family in the Nidovirales order, excuse me. Coronavirus represents those spikes. That's like my favorite part of the disease. I think it looks really cool. It looks kind of like those expanding fidget balls that you have. Anywho, they have those spikes that are outside of the virus that make it known as the coronavirus. In the microscopy, though, they're really small and they tend to be from 65 to 125 nanometers in diameter, I believe. Again, here's that single-stranded ribonucleic acid in the nucleic material. And then in the causative agent, again, here we've got a better view of coronavirus in the microscopy. This is the 40x view. So I find looking at the animated version here to be a little bit easier to understand in terms of understanding it and looking at it, rather than the microscopic version. So here, I just want to get a little bit more into that as well. The virus is a part of the beta coronavirus subgenus, Sarbecorvius. They also have the MERS, which is where the membrane protein, the envelope protein, S protein, and I believe, right, there's another, I don't remember what the R stands for, but those and the SARS-CoV, not CoV-2, originate in bats. And so that's what kind of made people and led to people knowing that SARS-CoV-2 has the correlation to originate in bats as well. Here's a better look at the microscopy again. And then here is the pathogenesis. These are the general implications that you get knowing that the pathogen and what makes coronavirus itself so, excuse me, I guess, attracted to you and want to make you sick are these components. So, excuse me, you will receive the fever from the alveolar vasodilation, and you get that from interleukin-6 and the permeability in that cytokine. This is the systemic pathogenesis, just if I didn't mention that to begin with. Excuse me. So you can get shortness of breath, difficulty breathing due to lung edema, and you can see interleukin-1, trying not to move the presentation, interleukin-1, interleukin-2, and then TNF. And then you've got mononuclear infiltrate that goes through phosphite. You can also receive those gastrointestinal problems with nausea, as I mentioned before. And unfortunately, that can lead to, with more gastrointestinal issues, with your liver function can be altered as well. You can start to develop maybe an eating disorder like anorexia nervosa, due to just having such implications and such complications with your gastrointestinal system. You can have cardiovascular problems as well. That has to do with your hypocoagulability, which means that you essentially you blood clot a little too much and you have inflammation as well. Get a little bit better look at this picture. And then here we've got pathogenesis broken down in the asymptomatic and the severe cases. So here we've got our B cells that lead, that lead to our memory cells, plasma cells, and those have T cell mediated adaptive immunity. So that essentially leads to people who can survive. They have enough immunity to be able to fight back and not have to be hospitalized. And that all occurs because of interleukins and the cytokine and things like that here in the asymptomatic and mild cases. Okay. And then here we've got our severe cases, dysregulation of type 1 and type 2 and type 3, IFN responses, hyperactive innate immune responses. And then here you see that it's kind of got like a tornado looking visual. That's called a cytokine storm. Interleukins 2, interleukins 4, interleukins 10, interleukins 6, and then IP10, and so on and so forth. That's all in that, which leads to systemic inflammation, septic shock, multi-organ failure. And unfortunately, that can lead to you passing away, or you can survive, but you have severe organ damage and you may need to get a transplant or be put on the list as well. Prior to that, though, you've got the suppressed or delayed adaptive immunity, and that is something that you should have that should be innate, where you have that innate immunity. Here we can go back to the beginning. You see activation of innate immunity. You need that in order to not lead to a severe case where all of these issues where you have the cytokine storm, macrophages, neutrophils are affected, ferritin is activating the suppressed adaptive immunity, which then all leads to you unfortunately passing away. That's really key. Okay. And then we've got these images here. That goes and narrows it down a little bit more from our last photo. We've got SARS-CoV at the very top, top left, and it goes a little bit more in depth with our spike protein 2 there and how it attaches to different S proteins and the proteolytic cleavage, which then leads to that more inflammation and lung issues as well. Virulence factors. So here, these are the specific spikes that go on the coronavirus, and those, excuse me, those have non-structural specifics of SARS-CoV-2, like that furin that we saw in the last photo as well. We've got the protease, ORF3b, and dynamic conformational changes within the spike structure during host cell fusion. So that is here. Sorry, let me make sure I don't slide. For example, SARS gets into your mouth. That's if you are near somebody who is contaminated with COVID-19 and they sneeze and you're really close to them. Those particles, you inhale them and they get into your alveoli. Then you see that in the cleavage of the SARS protein, the spike has now attached at the site. You go to the fourth step, that's the activation of S2. Fifth, that's the fusion of the viral lipid bilayer with the host cell membrane. So now that's when COVID-19 starts to embed in you. So yes, excuse me. The spike itself that attaches during host cell fusion, though, that's what makes it like, that's what makes it effective. And that's what made it so pathogenic and made the coronavirus into the pandemic that it was. Transmission. So as I mentioned before, you can inhale COVID-19 through air particles. So when you have poor ventilation, somebody who sneezes right next to you, and if you're not within 6 feet, they can transmit COVID-19 to you because there's not enough air circulation or distance within you, or between you and that person, to avoid having that issue. You can also receive COVID-19 by touching your face, touching your eyes, nose, and mouth with hands that have COVID-19 on them. So for example, say you were petting a dog and that dog was around somebody who had COVID. That transmission from animal to person is now occurring because you pet that dog. Another thing, you could be touching objects, you could be touching a doorknob specifically. That is another thing that can transmit COVID-19 as well. To elaborate, another thing that would happen with poor ventilation is if you don't have a respiratory mask to cover yourself or to prevent the transmission of those particles. Okay, so this is right around spring break, April 26, 2023. We've got different age groups of people affected by COVID. It most commonly affects the older age group though, because their bodies are more prone to inflammation. So here we are, you've got um, 3,589 cases, 3,589,421 cases at the top, and at the very bottom, we've got 1,944 cases. This is just like a big overview. I figured you guys can use this as a visual look at. Now, globally, there has been over, this is from dates June 12th to July 9th, there's over 794,000 cases detected, and 5+ World Health Organization regions have reported that there's been a decrease in cases in the African region though, but an increase in death but it's a relatively low rate in the first place. So even though there is a spike, there are not as many as prior. As of July 9th, there have been over 767 million confirmed cases and 6.9 million deaths had been reported. This is all a range of ages, genders, and each statistic is a cumulative. These range from country to country as well. And they also range from hospitalizations too. This is a visual of the COVID cases that are in the United States right now. So as we can see, pretty low. We do not necessarily have that issue, or we're not in a pandemic anymore in the United States, but there are some counties down in Texas that are really affected. So these white spots here in Louisiana as well. The highest concentration of COVID right now within the United States is in Texas in Dimmitt County. This is the culture part of our COVID-19. So when you get a culture, that is when you get tested. You're going to do either the rapid antigen test, or you're going to do the PCR, which is the molecular test. You can do viral cultures, and those are for people who would like to get tested for COVID-19. We use two different types, molecular and antigen tests sorry, we need to slow down. We use two different types of tests. We use molecular and antigen tests. A positive viral COVID-19 test means that that person has taken the test and now they can spread it to others. I find that antigen tests can be a little less accurate just because the molecular test can go more in depth and you can see the antibodies. Here is data regarding PCR versus rapid antigen tests and whether people were symptomatic on the day of the antigen test or whether they weren't. So here for a diagnosis, you can get tested using the PCR test to get to find out all of these. Some people feel like if they get a small throat itchiness, they should get tested, and that's completely fine. A PCR test, if you want to get that confirmation, you should definitely do that. A rapid test can get you those same results too. If you're symptomatic and you have been exposed, I recommend getting just the PCR though, because or you can get both as well. But I recommend getting the PCR because you're most likely to get a more accurate reading from those as well. And if you're asymptomatic, both work too. Molecular tests, again, the PCR polymerase chain reaction tests, they detect genetic material from RNAs, from the ribonucleic acid from the virus. I know that I personally, though, like I said, if you want to get tested just because you have a flu-like symptom, but you haven't been exposed, you can totally do that. I know that I've done that before. Okay, prevention. So in order to prevent getting COVID, you can wear masks. You can make sure that you get vaccinated and stay up to date with those. Follow your doctor's orders. That meaning you can get tested frequently to make sure that you are not a carrier of it. Boosting your immunity. I've done that where I've added probiotics, maybe eating yogurt more often, and just things that are better for your immune system. Going outside, proper ventilation is key as well. So social distancing, washing your hands properly, and again, wearing those masks properly. CDC recommends that in order to prevent COVID from spreading in like correctional facilities and institutions, you could do intake testing as well as people come in. Treatment, we've got these antibiotics that, I'm sorry, these are not antibiotics. I'm so sorry. These are antiviral medications. Antibiotics cannot treat COVID-19 because they only work against bacteria. They don't work against viruses, and COVID-19 is a virus, coronavirus. So some people who have COVID-19, they may have an additional infection or something like that, where in that case, then they may take an antibiotic as well, but that's not treating COVID-19, it's treating their separate infection that they may have. The time from exposure to symptoms, that's known as the incubation period. That's when your symptoms show up. Typically, typically like 5 days with earlier variants, according to Mayo Clinic, but I was talking about just the COVID-19 variant. So with this treatment, you can do Paxlovid, and that's an antiviral. You must start treatment within 5 days of the symptoms starting, and you have to take it at home by mouth. That can be used within adults and children from ages 12 and above. And then same for Veklury, that's also known as remdesivir, and you have to start taking that as soon as possible. You have to begin that within 7 days of your symptoms, and you get that at a facility through intravenous IV infusions for 3 consecutive days. And then lastly, we've got Lagevrio. That's also known as molnupiravir. I believe I'm saying that correctly. You have to start taking that also as soon as possible. The whole idea is just to start treating yourself as soon as possible, um, because otherwise you're going to feel a lot worse for a longer time, and you have to take that by mouth at home as well. And then I've got my references here. Okay, thank you.